Thanks, everyone. I'd like to open it up for questions. Jack, I guess I can call on you.
Yeah. Well, first of all, I want to thank Seth. I know he's leaving, but and his colleagues who helped him uh, with his presentation, which is just remarkable, just terrific. Thank you very much. I had two questions for you, John. And one of them had to do with whether or not there's experience with providing employers with incentives to put these kinds of accommodations into the workforce. You know, some kind of tax breaks or some, I don't know, any kind of whatever kind of incentive. And then the second question had to do with an experience that I had when I was CEO of a very large corporation, and once a year we would have an awards event for the best employees, and each employee would come up and I would give them some kind of an award. And as I introduced each of them, there was always, after their name, there was a three-letter code as to what office they worked in. So, you know, BOS was obvious, and NYC was obvious, and DFW was Dallas, Fort Worth, and so on. And there were many, many offices. And there was a winner of the best employee of the year. And she came up, and she was a WAH. And I said to her, I didn't know what WAH was, and I said to one of my assistants, I said, what is this? And he says, work at home. And I said, well, what do you mean? He said, this is the best employee in the corporation this year. She works at home because she's disabled, and her home was accommodated for her to live there. It was easier for us to have her work at home than for us to make the accommodations in the office, and she was the most productive employee in the company. So I just wondered about whether or not work at home as an option for accommodations to the workforce is something that is getting any traction.
So in response to the first question, yes, there are incentives, there are tax write-offs. There was under George Bush, there was a program that was started, and the states got money, but they could decide how to use their money. So often nobody heard about it, and often it didn't go to workplace accommodations. But there are vocational rehab in all of the states, work with employees and there's state money for that. So there are a number of different programs to offset the cost to employers. There's also some research that Syracuse has done in particular that has shown that, you know, and also some of the work that we've done more informally, that has shown that accommodations, you know, cost less than $100 for most accommodations. So it's not like we're talking about, you know, a lot of money for most things. In terms of the work at home, I sort of deliberately didn't put that in the presentation. We've done a fair amount of work with teleworking. My personal, and it's used more often, as you say, because it's easier for the company to allow someone to work at home. But, you know, by the same token, a lot of people ask to work at home, and that works for them, at least in terms of getting the work activities done, the work tasks. It certainly doesn't create participation in the workplace. And there are sort of the overcoming that is some of the social technologies that I talked about, that being able to bring people into the workplace from remote places offers the potential to create the same, the same feeling of physical space in a virtual world, in a virtual space.
And most people who work at home go to the office once every couple of weeks or once a month for the team meeting, the group meeting, the department meeting, whatever, in order to maintain some personal contact. Yeah.
That is if they can. So, you know, there's, for people who can't, then it allows them to work. The question is how satisfied they're ultimately going to be if they're not participating in the greater sort of milieu, social milieu of the workplace, which is, sort of left unsaid under the ADA and reasonable accommodations.
Hi, I'm Joe Caldwell with the National Council on Aging, and I really thought the data you presented about the less workforce accommodations for the older workforce was really pretty striking to me, and I hadn't seen that before. And I was curious if you had thoughts about how we can intervene in that, or any sort of policy recommendations to change that, and what's kind of going on there. I mean, is it that this is a population that's sort of aging into disability, so they might not self-identify as a person with a disability, or not be aware of the ADA, or know to ask for reasonable accommodations? So I was just curious what you think's going on and how we can intervene.
So I think that you're right. There's a lot of, while we didn't ask what was going on, we're just finishing up a study now on computer use by older adults and what kinds of accommodations they get or make. And so I don't have really the data because that was focused solely on people aging and did ask those questions. my understanding is that yes, that people are not aging in place and don't have accommodations. They would have had it coming up, through, from having had a disability at a younger age. I think that what's going on is people, one, don't know to ask. Two, they don't recognize aging as disability, so they don't know that they're eligible for an accommodation. And then three, I think a lot of people just don't want anyone to know, because if it looks like they're losing function and there's a perception that they can't do their job, then they're going to, get gone, early retirement. And people tend to retire rather than get accommodations because they either don't know or don't want, they go somewhere else. It's a tough question, and it's a good question, and unpacking that's going to be sort of our aim in this current project.
I wondered, this is Margaret Campbell from NIDR. I wonder, picking up on Joe's question, I wonder also if we tend to think of disability as discrete. You have it or you don't, and you have one. You have a vision impairment, you have a hearing impairment, you have a mobility impairment. But when we're talking about older workers, we're very frequently talking about people with multiple disabling conditions that don't fit into one of those categories. And also probably much more, and we also have illness as opposed to a more static disability condition. So I wonder if there are some problems in our workplace accommodation model, in our accommodation model period, in terms of extending it to older adults in the workplace who not always, but very frequently, the nature of their disabling condition is different. More, maybe in some ways more complex, but also different. So I wonder if you could speak to that, separating out multiple disabling conditions from discrete disabilities.
Well, clearly it's accommodating older adults because they have multiple conditions is much more difficult, although there's nothing I can't, under the current model of reasonable accommodation, there's nothing to prevent all of those conditions from being reasonable or reasonably accommodated. I think the bigger issue is what happens when people are left out, when they've been able to participate in the workplace for 50 years and now because of their condition they can still do, or conditions, they can still do their job, but they can't get to the cafeteria, they can't meet someone in the hallway, they can't go out they can't go represent the company or go on a training. They just can't. They can't even go to the to the office party for Christmas because it's in an inaccessible place. So I think the awareness and the understanding of how to keep people engaged in the workplace, not just engaged in work, is the big issue. I mean, I hate to sound like a broken record for it, but it's just not something that we do. It's not in our paradigm. It's not in our thinking process.
Other questions?
Actually, I like sounding like a broken record. I'm sorry. Maybe we'll get it through.
All right, well, great. I'd like to thank our panelists. Appreciate it. And I'm going to turn it over to Margaret.